Welcome back to MLT 120. Today we're going to be learning about red blood cell indices. The indices are part of the CBC panel we run in hematology. Indices measure things like the shape, size, and quality of the red blood cell. We're also going to be learning how to do some calculations that go along with the indices. So what is the purpose of the red blood cell indices? I've already said it's part of the CBC we run in hematology, but the indices help define the size of the red blood cells and also the hemoglobin content within those red blood cells. It also helps us differentiate between some of the different anemias that we've learned about. Also, our indices are going to help correlate what we see on the smear observation, the actual observations that we see on our blood smear slide with the count from the automated analyzer, or it could be a manual count that we perform. And the indice results are usually given or populated by most of our automated hematology analyzers that are used in labs nowadays. And again, they're part of that CBC. And if you don't know what CBC stands for complete blood count. And of course, our CBC panel is our most common panel run in the hematology section of the laboratory. Okay, so the very first indice that we're going to talk about is the MCV, or the mean cell volume. And the formula that's associated with the MCV is the hematocrit times 10 over the red blood cell count. So you'll need to make sure that you memorize these formulas. They're pretty simple. Each one is going to be similar, but you need to make sure that you know the difference and have each one memorized. For the mean cell volume, it's going to give you information about the size of the cell. So this information is going to tell us how big or how small the red blood cells are. The normal value for the MCV, or mean cell volume, is anywhere between 80 and 100 FLs, which is femtoliters. And red blood cells with an MCV of less than 80 are considered microcytic. Any red blood cells that are greater than 100 are considered macrocytic. Something to note for your MCV valuable. If you have a lot of variance in the size of your red blood cells within a sample, then this value is not going to be of much value to you, because it's not going to be a real dependable value, because your red blood cells are kind of going to be all over the place as far as their size, because you have varying sizes, large, small. So this value is just not going to be very dependable or very good value for you for an evaluation of size of your red blood cells. The next indice is MCH, or the mean cell hemoglobin, and the formula for it is the hemoglobin times 10 over our red blood cells, and we use it to tell how much hemoglobin content is inside our red blood cells. So we're using this value to tell us what's inside the red blood cell. The normal values are 27 to 32 pictograms. The red blood cell with the MCH of less than 27 are hypochromic. So it's going to tell us about the color. Remember, the hemoglobin inside the red blood cells, the amount is going to affect the color of the red blood cell itself. The MCH with a value should correlate with the MCHE value, which we're going to talk about on the next slide. Okay, the third indice we're going to talk about is the MCHE, which is the mean cell hemoglobin concentration. The formula is the hemoglobin times 100 over the hematocrit. Okay, where before we've been talking times 10 on the previous two formulas. This one's times 100, and this time we're over hematocrit. So make sure you note the difference. And for the MCHC, it's going to tell us about the hemoglobin content as well, and it should correlate with the MCH that we just discussed. The normal values are a percentage. It should be between 32 and 36% for your MCHC. The red blood cells with the MCHC less than 32 should appear hypochromic. Again, we're going to be affecting the color because of the amount of hemoglobin that is either in the cell or not there. So if it's less, your color is going to be less for your red blood cell. The MCHC values of 36 to 38 should be checked for spirocytes. Remember, our spirocytes usually have darker colors or darker red color, so they're known to be hyperchromic. Values greater than 38 must be investigated for an error. So why are our red blood cell indices important? The answer is classification of anemias by our red blood cell indices. The red blood cell indices are useful in classifying those anemias that we talked about because we run these indices along with our CBC panel. Okay, so we know that our anemias fall in some of the categories that are listed down here. Some of our anemias are normocytic normochromic. Some of our anemias are macrocytic normochromic, or even microcytic hypochromic. So this information here that can be given by the indices can point us in a direction of which anemia we might be dealing with a patient. The next concept that we need to know about is the RDW, which is the red cell distribution width. This value is provided by most of our automated hematology analyzers, and it's an index of size variation of our red blood cells, and it can be used to quantitate the amount of anisocytosis or variation in size of our red blood cells that we have in a sample. So if we have an increase in the RDW, we most likely have anisocytosis in that sample, or a variation in size of our red blood cells in a sample. We're not so much concerned if we have a decrease in this value, just as if we have an increase, because that's telling us we have anisocytosis. The normal range is 11.5% to 14.5%. So let's look at this example together for RDW. We have patient Tweety that has an RDW of 18.2% on an automated CBC analyzer. What would you expect to see in the peripheral smear? Okay, our normal range is 11.5% to 14.5% for our RDW. So we know this is an increase, being 18.2. So the answer would be the RDW is increased, so we would expect to see anisocytosis on our peripheral smear. This means we would see red blood cells of varying size. So now let's do some calculations for MCV, MCH, and MCHC with this example. And we're going to work them out on the slides that are coming up. But let's look at our example first. We have patient Snoop Dogg that has the following results. He has a red blood cell count of 4.25 million, a hemoglobin of 12.5 grams per deciliter, and a hematocrit of 38%. And again, we're going to calculate the MCV, the MCH, and the MCHC. And based on those results, we're going to describe how the patient's red blood cells should appear on the peripheral smear. So the very first value that we're going to calculate is the MCV. So when we're going to calculate that, we're going to have to plug it into our formula of the hematocrit times 10 over our red blood cells. So if you remember, our hematocrit for our patient was 38, and times 10 is part of our formula, and we're going to put that over our red blood cells, which was 4.25 million. And if you do the math, 38 times 10 is 380. Divide that by 4.25. You should get 89.4 hectoliters, or FL. And that is within normal range for our MCV values, which is, our normal range is 80 to 100. So we should expect to see normocytic cells on the smear. Remember, our MCV values are telling us about the size of the cell. Okay, now for our MCH calculation. Again, we're working with patient Snoop Dogg. The formula is the hemoglobin times 10 over the red blood cell value. Snoop Dogg had a hemoglobin of 12.5 times 10 is part of our formula, and his red blood cell count was 4.25. If you do the math on that, 12.5 times 10 is 125. Divided by 4.25, you should end up with 29.4 pictograms. And the normal range is 27 to 32 pictograms. So we should expect to see normocytic red blood cells, because with the MCH, we're looking at the hemoglobin content, so that's going to affect the color. So we should also suspect that this patient should have normochromic cells, but let's work out our MCHC and let's see if we can confirm if he does have normochromic or normal colored red blood cells. Now for our next indice, we're doing the MCHC, and this one's going to be looking at hemoglobin content as well. For this formula, we're going to be using patient Snoop Dogg's hemoglobin times 100 over the hematocrit. So the hemoglobin was 12.5, and this formula we're multiplying by 100, and we're dividing by the patient's hemoglobin, which was 38. And if you do the math on this one, 12.5 times 100 is 1,250. Divided by 32, you should end up with 32.9%. And if you look at our normal range for MCHC, the normal range is 32 to 36%. So we should expect to see normochromic cells or normal colored red blood cells, as we suspected when we did the MCHC, because again, the MCH and the MCHC should correlate because they're both looking at the hemoglobin content, which affects the color, how light or how dark the red blood cell is. So based on the calculated red blood cell indices for this patient, we should see normocytic, normochromic red blood cells on our smear, or the slide that we make and look at under the microscope. So our MCHC and our MCH does correlate. Let's look at a couple more examples of patients. So in this example, patient Charlie Brown, a male, age 25, has the following red blood cell indice results on his CBC. The MCV value is 75, and we already know this is decreased based on the normal values of 80 to 100. Okay, keep that in mind. The MCH is 25, is also decreased based on the normal range of 27 to 32. So both of these are decreased. The MCHC is 29. Well, guess what? It's also decreased based on the normal range of 32 to 36. So based on these values, how would you expect the red blood cells to appear on the blood smear, or this blood smear slide that you may look at in the microscope? Well, based on the fact that all these values are decreased, the MCV value is looking at the size. So we're going to expect the red blood cells to appear smaller, so they're going to be microcytic. because the MCV value is decreased. Well, both the MCH and the MCHC are both decreased. So we're going to think, or we're thinking they're going to be less in color because they're going to have less hemoglobin in the red blood cells. So they're going to be hypochromic. So these cells for this patient are going to be microcytic, hypochromic, based on these values. Okay, let's look at another example. This patient Daffy Duck, has the following CBC indices on his CBC. So let's look at the MCV. The MCV is 105. So we know the normal range is 80 to 100. So this is actually increased. So if it's increased, we automatically know that we're dealing with larger red blood cells, right? Okay. So for the MCH, and this is a typo, this is a MCHC, there should be another C right there, is 33%. Well, for the MCH, we've got 30. Well, the normal range is 27 to 32. So that's actually in normal range. How about 33%? The normal range is 32 to 36. So guess what? That's a normal range. So both of these are in normal range. So based on the values, how would you expect the red blood cells to appear on our slide, or the blood smear? Okay, we already know this one's going to be large, or the red blood cells are larger based on the MCV. So the answer would be macrocytic because of the increased MCV, but based on these two values, they're going to be normochromic, or normal colored red blood cells. So Daffy Duck has macrocytic normochromic red blood cells based on the red blood cell indice values. I hope you have a better understanding of the red blood cell indices and why they're important to the CBC. And if you need any help with these calculations, don't hesitate to reach out to me through email or during my office hours.